Hello, everyone. I hope you are enjoying your day so far. My name is Brittany McNamara. I'm the Development Director for the Children's Coalition for Northeast Louisiana. And before we get started, I want to go over a few quick housekeeping items. You can chat with our speaker or myself in the chat box. And if you are having any tech questions or problems, just feel free to chat me and we'll get those taken care of. Any questions that you want to ask for the Q&A session at the end, just put those in that little Q&A box at the bottom of your screen, and we'll go over those at the end. So anytime you have a question, just pop that in there. So let's get into our last session before we go into our lunch panel. I know everybody's probably getting hungry. So Dr. Lauren Broussard serves as the Associate Director of the My Community Cares program at the Louisiana Public Health Institute, LPHI. MCC is a statewide program grounded in community and neighborhood-based interventions aimed at reducing foster care placements among families at risk. In this position, Dr. Broussard brings to bear 20 years of experience in public health policy and programming within the federal government, at academic institutions, and with a variety of community-based organizations across the country. Dr. Broussard obtained her Bachelor of Science in Psychology at James Madison University, her Master's of Social Work and her Master's of Public Health at Tulane University, and her doctorate in Public Health at Columbia University. Her dissertation is titled The Social Safety Net and Social Vulnerability, Examining COVID-19 in the NYCHA Developments of Brownsville, Brooklyn. Dr. Broussard is passionate about addressing and intervening upon the structural contributors to racial health inequities through policy advocacy, development, and change. Without further ado, I introduce Dr. Broussard.
Thank you. Thank you so much for that warm welcome. And thanks so much for the invitation to participate in this conference. Today, we're going to be talking about fortifying our villages, supporting mothers, and mothering in an effort to increase household stability. So first, I want to set context. I mentioned mothers and mothering because in many of our lives, we have our biological mothers, our custodial or adoptive mothers, but we may also have other people in our lives that played the role of mothering. And all of those people should be included when we think about what it means to strengthen our village to create stability amongst families. I use the language of fortifying our villages because we've all heard that saying that it takes a village to raise a child, but in our most vulnerable communities, the question arises, what if the entire village is suffering? And we often see that. We see that a lot in my work with My Community Cares. In many ways, mothers are the backbone of our villages, and by ensuring their health and well-being, we are also ensuring the health and well-being of everyone else in the village. Taking good care of our mothers and the people who mother us is truly a rising tide that can lift all boats. When I talk about taking care of mothers, I want to be clear that the goal is not to increase simply the survival of motherhood. We want to protect and support mothers so that they can thrive in that role and show up as their best selves in that role. Another matter of language that I want to be very clear about before we jump in is the use of the term resilience. I am very hesitant to use the term resilience in this type of work because resilience is demanding and very taxing and exhausting. And so I would rather catch people before we have to demand any sort of resilience from them so that we can greet them with care and support, and they don't have to be strong even when they're running on fumes. So let's jump into a broad conversation about maternal mortality in Louisiana. There are some indicators that are most prevalent when we look at maternal mortality across our state. Unfortunately, violence is one of them. Often domestic and intimate partner violence affects the lives of pregnant people, mothers, and that can be, of course, very destabilizing in a family. Lack of health care, access, food insecurity. Just yesterday, I was introduced to the concept of not just food deserts, but food swamps. So communities that are disproportionately served by low quality or fast food outlets, so that it's not that there is a complete lack of food available in the community, it's that there's a lack of quality food and an overabundance of low quality food. We all know that our diet relates to chronic and underlying conditions that folks might enter into motherhood already having, tobacco use, obesity, stress. I think we've all heard the phrase that stress is the real killer. And so we see cardiovascular and pulmonary health issues that are often tied to stress. Last and certainly not least is housing instability. If we think about Maslow's hierarchy, we know the importance of not just having a roof over your head, but having safe, quality housing that is stable, where you're not experiencing the stress of, okay, I'm allowed to live on this person's sofa for a few weeks, and then I need to pack me and my children up and find another place to stay. Sorry, there's some lawn care that, of course, just started right outside of my window. Housing instability in terms of quality housing. So we know that in Louisiana, we are a climate vulnerable state, and I have, with my own eyes, seen folks who are living with long-term issues of mold not being remediated or aging housing that may still have lead and asbestos that hasn't been remediated. So I'm putting all of that under the umbrella of housing instability. Understanding the context in which we are currently operating is key to ensuring that our efforts are directed at root causes and not just symptoms. And we're talking there about the root causes of maternal mortality and maternal health risk. So by being very clear about the state of affairs when we're entering the work, we are able to effectively focus on prevention in a very real way. And prevention, I would say, includes disrupting the cyclical and compounding nature of risk. Lots of our families might be presently mired in one of these issues we see listed here, but we can always prevent things from getting worse. So the March of Dimes gave the state of Louisiana a failing grade on most indicators of maternal and infant health, including rates of smoking during pregnancy, environmental factors such as extreme heat and poor air quality. And the March of Dimes also noted that the state has failed to adopt and sufficiently fund policies that could expand healthcare access, such as midwifery and doula related services. So all of those are things to keep in mind when we think about how do we want to approach the work of improving maternal health for the improvement of family stability. It is critical in this conversation to be very direct about what's happening at the intersection of poverty and racism. And I believe the answer there is that something absolutely catastrophic is happening at this intersection, where folks are dually marginalized from supportive services in their community. Some of the issues that relate to both poverty and racism. One issue relating to poverty is high rates, and Louisiana has very high rates of STIs, or sexually transmitted infections, among teenagers. We know that certain STIs, even those that are bacterial infections that could be fairly easily treated, when left untreated, can compromise maternal health later in life, and therefore also compromise infant health. Low rates of preconception counseling. So in our work with My Community Cares, I have several times now met mothers who are expecting their 8th, 9th, or 10th child, and have never engaged in a thoughtful conversation about how large do I want my family to be and why? What's driving those decisions? When can we bring her partner into those conversations? So that's something for consideration, as well as interconception care. This is a fairly new field of study to me, but making sure that mothers are receiving not just the standard postpartum care, which we know a lot of moms are not receiving, but being engaged in conversations about spacing of pregnancies. How large do you want your family to get? How does your body feel between pregnancies? What did you experience during a previous pregnancy that you don't want to experience again? Also in Louisiana, we have to be very aware of the impact of high Medicaid usage for birthing people, that a significant percentage of births in Louisiana are covered by Medicaid. And what does that mean about the economic situation that those families are in prior to the delivery of that child? That being said, we cannot ignore how deeply race and poverty are so linked and enmeshed in our culture. We see that when it comes to indicators of lack in terms of economic resources, that at the bottom are also a disproportionate portion of our Black and Brown communities across the state. These inequities also, we know, are linked to increased rate and risk of pre-existing conditions. So we know, for instance, that a disproportionate number of Black women are affected by hypertension. And hypertension can impact maternal health outcomes. One statistic that I think is always worth regarding that sticks out to me is that 1/3 of women in Louisiana identify as Black or African American, but 70% of maternal deaths are amongst Black and African women. So that statistic is a clear indicator there that disparity, that overrepresentation in poor maternal health outcomes. So moving just beyond maternal health, I want to talk about what's the role of motherhood, the role of mothers, the role of mothering in our families. And, this is a cheeky graphic to use here. We see variations on this graphic, but there's a lot that perhaps even if it's depicted in this graphic is not said explicitly. So let's dive in a bit with that. So the role of mothers as the administrator of the household, the organizer of finances, the person who is tracking household tasks, household needs. There's also a management role for the person playing the role of mother or acting in the role of mother. Making sure everyone's getting to where they need to be, making sure that there are groceries, including snacks, that meal preferences are being attended to. I think what we sometimes miss about the role of mothering is that there's a tremendous amount of emotional and intellectual labor. And that labor has a very real, not just psychological impact, but a physiological impact. And being in the role of mother is so much more, than being a chef or a chauffeur. A couple of examples that I like to rattle off are, it's not just getting a child to a doctor's appointment, right? It's identifying the need for a doctor's appointment, finding an appropriate provider that you can travel to, right? Depending on the quality of your transportation, reliability of your transportation, ensuring that that provider takes your insurance, that you will be able to pay them, scheduling that appointment. For working moms, especially, that can be very difficult because, as we all know, doctors tend to keep that same Monday through Friday 9 to 5 schedule. So scheduling so that you can attend the appointment with your child, meaning you can step away from work, that you can get your child from school or home to the appointment. So you're arranging those absences as well. I mentioned transportation. Many of the families we work with through my community cares are reliant on public transportation to the extent that it is available in their communities, and that varies tremendously statewide. One of the scenarios that we talk about quite a bit is if you are a single parent of multiple small children, then the task is getting everyone into a car seat and then everyone out of their car seat. If we're not talking about your own private vehicle, then we're talking about installing multiple car seats, getting these small children into multiple car seats, getting yourself into the car, getting to your destination, uninstalling the car seats, and getting the kids out of the car, and then arranging for your travel home. We know that's not uncommon, and it's a tremendous amount of labor that we might not always identify when we're thinking about, oh, that child needs a doctor's appointment. Following up after that doctor's appointment, getting prescriptions from a pharmacy, ensuring that those prescriptions are taken by the child or the other person in the household as prescribed. In the example of thinking through what is required for the academic success of children in a household, that requires schedule management, making sure kids are getting to bed and getting up in time, that they are prepared for their school day, that if they're going to have breakfast at home, that they are having breakfast at home, If they're receiving breakfast at school, making sure that your transportation is in line so that they're at school on time to receive breakfast. Same with lunch. People in mothering roles, mothers at home are often the ones who are disproportionately paying attention to, okay, what was the homework assignment? When is it due? What field trips might be coming up? What paperwork do I need to sign off on? Is there supportive care or supportive services that are needed for a child who might be neurodivergent in some way or requiring additional services? Communicating with teachers as often as is needed, attendance at parent-teacher nights. And then there's the whole constellation of extracurricular activities that so many children are enrolled in. And those extracurricular activities are often at tremendous expense, right? We know that expense can often be prohibitive, that they often require additional transportation, additional paperwork to be signed off on. So there's a lot of kind of invisible labor that we see happening. And just because that labor is invisible doesn't mean that it doesn't have a very real impact. And so on my next slide, and we're going to hope that you two cooperates with us. But I want to talk about what it means to see burnout in mothers and what it means to support mothers, again, for the increase in stability amongst families. So bear with me while I get this queued up. We're going to have to wait through a couple of commercials here. I apologize about that. Yeah. I see a couple of notes that the sound is not playing. Thank you so much. So I don't want to mess around too much with the video. I'm happy to provide a link. But just to keep us moving, I'll describe essentially what the speaker is saying. You can see that this is from one of the TEDx TED Talk series. So the speaker is discussing maternal burnout, what that looks like, what the impact of it can be, and how we might interrupt that burnout by offering mothers real social support, tangible social support. I like this clip, and I included this clip because that is exactly what MCC, My Community Cares, the program that I administer with LPHI, that is what MCC is striving to do. And I wanted to share a couple of examples of what that looks like, because we are very much focused on collective impact and the role that we can all play. So a couple of my favorite examples of what it looks like to provide social support that allows us to take better care of the mothers in our community. So one example comes to us from our program in Livingston Parish. They were, they had have a client who was actually a grandfather who needed to take custody of 3 grandchildren, and he was just completely overwhelmed. So they got him set up, diapers, clothes, some groceries. This grandfather had worked his whole life as a mechanic. And once he was able to get stable and on his feet, he gave back to the community by providing free oil changes to all of the single mothers that were part of that community. To date, he's done at least 40 free oil changes. And the impact of those free oil changes cannot be understated. A working vehicle means that somebody keeps their job, that kids get to school, that a CPS investigation is avoided, and that a family can stay home together in a way that is safe and healthy. Other examples from the My Community Cares program is that our sites host monthly parent cafes, and some sites have had tremendous success providing not just child care, but child enrichment, whether that's homework support, study support, mental health support while the parent is in the parent cafe. Again, this session is very much focused on mothering and motherhood, but I want to make clear that for not just myself, but My Community Cares as a program, and writ large, I believe in the importance of engaging fathers directly. So not necessarily engaging fathers through the mother, right? Because that's requiring additional intellectual and emotional labor. So across MCC, we are working to develop regular events where fathers are encouraged to attend with their children in a way that is fun, so they can be creating memories and starting traditions with their children. And they can also receive resources directly. We have heard from fathers in different regions across the state of, I'm not in the household, or my relationship with the mom isn't strong right now, but I want to be involved. I just don't know where to start. And I think part of supporting family stability is ensuring that a parent who wants to be involved has a clear path towards involvement, that the labor of parenting is shared in an equitable way. Again, I want to speak realistically. I know that that's a lofty goal, but we're committed to working towards it. So I believe strongly in that. In addition to fathers, we know a lot of our most vulnerable communities have many non-traditional households. So there may be multiple generations in a household, or grandparents are the primary custodian, or an aunt or an uncle, even an older sibling. Intervention before burnout means ensuring that whoever is in that role has the right support. So in terms of older relatives that may be in a parenting role, the state of Louisiana allows for up to a 3 times great grandparent to take custody of a child in a kinship situation. I've never even met any of my 3 times great grandparents, so I can't imagine how different life was for them versus what life was like for my mother raising me. Through MCC, we want to engage those folks in making sure, do you have all of the care in your aging process that you need? Are you enrolled in all the benefits you might receive? Are there parenting classes that we can get you into? Are there disability support services that we can get you connected with so that you can get some support, baby proofing or toddler proofing your home? So it's a very holistic approach to supporting a mother, a parent, a household, so that they can show up as their best selves and show up in a way that's more stable so families can stay together. We also believe that there is a strong role for my community cares to play when it comes to policy. There's a lot of direct service you can provide, but at some point, we know that our vulnerable families are running into policies and systems that are undermining their health and well-being. LPHI is a nonpartisan organization, so none of this is stated with any judgment. In a past life, I worked on Capitol Hill for many years. And I think just kind of the brass tacks of it is that with elections and new administrations coming in, we see a shift in policy priorities. And so the role of advocacy is just to make clear what policies we see are benefiting our communities and speak up so that those policies are protected, upheld. Examples would be Head Start. We know that Head Start is a tremendous benefit. SNAP, EBT, WIC, that nutrition support that perhaps does not resolve food insecurity issues, but certainly can mitigate food insecurity issues. And while we're doing that advocacy work, we also, through my community cares, are wanting to spark a conversation about community gardening. And is that something that's available to this community that they can do safely? And would that be a help? Is that a good use of our effort? And of course, that requires a lot of community input. That requires bringing in specific experts. I am not a food insecurity expert, but we certainly know who to call. And then engaging families in a conversation, a realistic and honest conversation about what's right for them and what would work for them. Okay, so this is going to be kind of where I end, and just some things for us to consider as we move into conversation. I am very passionate about the idea of creation and innovation through collaboration. What would it look like to increase access to midwifery and doula services? What's beyond education? We've done a lot of education about the harm of tobacco use during pregnancy. So what are still the barriers that exist? Perhaps tobacco is an anxiety coping mechanism that this mom is using because she may not be aware of other things that she could be using that might be more healthy. Can we engage her in a conversation around that? Additionally, reducing stigma around sexual health and healthy relationships. We are deeply committed with MCC to using person-first language. It can feel a bit clumsy and awkward in the beginning, but we do see that it makes a difference. engaging non-traditional partnerships and methods. If we can identify that the systems as they have been operating for however many decades are not working, then perhaps we can use the term I like to use our radical imaginations to imagine a different world, a different system. And once we dream that big dream, then we can start to identify the components and the steps so that we can move towards that. And so as we move into questions and conversation, I encourage all of us to regularly engage our radical imagination as we look at what is required to fortify our villages. Thank you so much for your time, and I will stop to take some questions.
Does anybody have any questions for Dr. Broussard?
I do see one in the chat. Yes, so the MCC site in Washita Parish is at the Wellspring. Other sites in North Louisiana, other agencies that we can partner with. So we do have a Shreveport MCC location at the Volunteers for Youth Justice. They serve Caddo Parish. One of the things that MCC is working really hard on right now is expansion. This program was originally launched to be regional, and we know that in the grand scheme of things, Monroe might not seem like a great big city, but it is the most urban area in that region of Louisiana. And we don't want to continue to not adequately serve families that are in those rural surrounding parishes. So we are looking at what expansion would mean. We feel strongly about not reinventing the wheel. And so we are engaging community clinics, first responders, schools, libraries. So I would be happy to continue that conversation. And I will actually be in Washita Parish at the Wellspring in the first week of December. So if the person who made that comment would like to chat at that time, I would welcome that.
And I'd also like to say to Dr. Broussard, the Children's Coalition, we also partner with the Wellspring on the My Community Cares program. So we kind of co-promote and co-brand that. And so to Jessica too, if, you could always reach out to us, the Children's Coalition, if you ever had any questions about, that as well. So thank you, Dr. Broussard, for what you have created and what you are advocating for the change in our communities. So yeah, our Family Resource Center here at the Children's Coalition is the program that works with the Wellspring and for the My Community Cares. And our community is full of great resources. So we all want hopefully the same impact in the future.
Absolutely. And so I will say, and there's not too many people in here, so I don't think I'm talking out of turn. But when we do our site visit at the Wellspring on December 3rd and 4th, on December 3rd, we'll be hosting a working lunch where community members are invited. And the Wellspring staff with My Community Cares is organizing that. So I would say, please do reach out to them if you're interested in participating. And that would be a great time for us to gather, break bread, and talk in person.
Yeah. Well, I look forward to hopefully getting to meet you in person on that day. So.
Yes, that'd be great.
Do we have any more questions? I don't see anything that has come through. Well, we're
I was
about
gonna say I can drop in, what I'll do is drop into the chat the link to that YouTube video
okay. I'm sure that would be helpful.
if folks want to see it. There we go.
All right, well, we've got about 5 minutes, so I'm going to go ahead and kind of give the end of session details, if you will. So I just want to thank you everybody for joining us and to Dr. Broussard for sharing her expertise. Again, that was some great information. So again, when this session ends, the Zoom app is going to close out and you'll be brought back to the event lobby. There's gonna be a pop-up in the top right of your screen. We ask if you'll just take that quick survey. We would greatly appreciate it. And also, when you're in the lobby, you can check the sessions tab for details for your next session, which will start at 11:55. Be sure to join us for the lunchtime panel session to hear how experts across the state are using unique strategies to fund early childhood education in their communities. If you have any additional questions or need assistance, our support team is always here to help. Thank you again, and we look forward to seeing you in the next session. And Dr. Broussard, again, thank you so much for being here.
Thank you so much, Brittany, and thanks for everyone who attended, and thanks for having me. Y'all have a great weekend.
Thank you.
All right, bye-bye.